Hi, friend. You're in the right place. This is the Beauty in Burnt Toast. Life gets a little messy, faith gets real, and hope shows up when we least expect it. Guests pull up a chair to share their stories, the good, the hard, and the how did that even happen moments. So grab your coffee, maybe some actual burnt toast, and settle in. This is the Beauty in Burnt Toast. Welcome back to another episode of the Beauty in Burnt Toast. Y'all, I am so excited. It is 2026 and this is the new podcast studio. I am thrilled. We have soundproofing. It's our own space. I'm so excited. And today we have our first guest, Deborah Brooks, and I am thrilled to be back in the groove. So today we are diving into a special 4-part series called Listening to Your Body, Deborah's Story of Breast Implant Illness. And we're talking about breast implant illness, but guys, this is not something you want to miss because that is not what it's all about, and that is not the entire point. You want to learn about listening to your body and advocating for yourself is the main point that we're taking away from all this. So it's a story about faith, courage, and learning to actually hear what our bodies are trying to tell us or what they're yelling at us. So grab your coffee, your tea, or whatever your fuel is for the day, and let's lean in. So this first series is how I learned to care for others. So Deborah is a nurse practitioner with a story that starts long before any of the scary stuff. We'll hear about how God called her to care for others, how she learned to listen, not just to patients, but to the quiet nudges, and sometimes those change everything. Spoiler alert, this is the calm before the storm, but you're going to want to hear how it all began. So hang with us. I'm going to read you just a little bit about Deborah. She became a nationally board certified nurse practitioner 25 years ago with a mission and an agenda in mind for changing the way medicine should be practiced. She is a lifelong business owner, certified in both functional and anti-aging medicine as a holistic wellness expert, book and podcast coming soon, and also a local healer who conducts wellness retreats and is on a mission to bringing and bridging the change for the healing power of women. Deborah has roots in Eastern medicine and was co-raised by a Japanese aunt whom she credits for the deep love of nature and all things natural from the earth. Her lifespan roots and education taught her to ultimately use her God-inspired medical and healing talents in intuitive callings to heal the human body. Deborah is a Shinrin-yoku master and plans to incorporate healing treatment modalities alongside earth and water healing sessions on her 40-acre farm in 2026. That sounds fabulous. She networks with many other healthcare professionals and like-minded women to bring a host of educational as well as natural and spiritual treatment modalities for full-body immersive holistic wellness from the inside out. From earth and water, which I know water is your favorite,
Yes.
to heal the mind, to the body and spirit, revelation to complete solid, Christ-centered healing of the soul. Her next upcoming Healing Women's Retreat is being planned for late May, early June 2026. Lots of exciting stuff. And we had the chance to sit down for coffee. What's it been? Maybe a month or so ago now. And I think you could literally just sit there for hours and just listen to her talk and not say a word because her story is just so interesting. She is an awesome person, and I would even say friend at this point that I have got to know and trust for myself as well, just when it comes to medical questions. You know, as a woman, we always have stuff going on. You know, hormones are insane, everything is insane. So I just trust you and your expertise in all of this. So
Well, thank
let's
you.
get into it. I know that was a lot, but
Well, thank you.
yeah,
Thank you. Very nice
yeah.
introduction, and everything looks gorgeous in here.
Thank you.
Just the ambiance and the feel and
Yeah.
the calmness. It's just fantastic. I
Yes,
love it. I
so
love
much
it.
better. I'm super excited.
But let's get into you. So, what called you to healthcare? Where did it all begin, your journey?
My very interesting journey from the time that I was born in a little small town in Princeton, West Virginia, where I was one of three children. I was the middle child. And my father, whose name was Hartzell, I think I shared with you, which I
It's
found to be
crazy.
crazy and interesting, Um, he had always told me the story about the day that I was born. And so I think at my birth, things got kind of interesting. Dad would always tell the story of, hearing a voice telling him, hey, everything's going to be okay with the wife. Back in the day, they did not allow the father back into the delivery
Yeah.
room. So dad's out there patiently waiting. And voice tells him, Hartzell, look out the window in Bluefield, West Virginia. Look at the huge clock on the side of the mountain. Look at the time. And Dad said he looked out and he noticed that it was 5:12 p.m. that evening. And he said that God spoke to him and said, your daughter has been born 5:12. So when Dad gets back to see Mother, she's very irritated because she thinks the nurses have spoiled everything and told Dad that she didn't get the privilege of doing that. And he said, oh, no, no, that didn't happen.
Yeah.
God told me.
Yeah.
So I felt hearing that story in my life that God had given purpose, He'd given meaning. And I may not have understood that or even processed or synthesized a lot of that even when I heard it, just because I thought maybe it's just a story of pride that parents will kind of tell because all kids, all parents feel that their children are special,
Yeah, of
you know,
course.
you know. But I felt that God had chosen me, and I knew in my heart that He had. And I knew that as things transitioned in my life and as I got older, He would begin to show me the way. He spoke to my spirit as a very young age when I became a Christian at the age of 13 and dedicated my life to God.
Yeah.
And that was an amazing turning point, you
So,
know.
did you ever want to do anything else besides being healthcare?
Well, I knew that when I had my first child and she had a lot of complications, they didn't even think that she was going to live. And even with feeding her, made the big mistake back in the day of feeding kids cereal through a bottle.
Oh, yeah.
You mix
Well,
it
that
up
was
kind of
popular
watery. It
then.
was
Yeah.
popular back then. Well, she nearly strangled to death
Oh, my
on me.
goodness.
And I was totally alone at my mom's house with my oldest daughter, Krista. And I went into panic. I mean, she turned blue. I just stopped. I started praying, God, please help me. I don't know what to do. Don't let my baby
Yeah.
die. It was scary. And I never had any CPR. I was young. I was 19 years old. And in my mind, something just clicked, and I flipped her over on my lap and started hitting her really hard on the back, and the liquid food dislodged, and she took a big breath. And after that moment, I said, I'm young, I have a child, but my child deserves so much more.
Yeah.
I have to do something with my life. And so, not long after, I saw an advertisement in the local Bluefield Daily Telegraph newspaper. Remember those days? And it was an advertisement for a New York psychological exam that could be taken in order to enter a licensed practical nursing program.
Interesting.
And I thought, wow, that's kind of wild,
Yeah.
but what are the chances? What the heck?
Yeah.
I want to try this because I felt that calling. And so I took the test. There were over 200 people. And out of 200 people that took the test, 25 of us made it in. And I was one of those
Yeah.
25.
Awesome.
So that's where I actually started.
It was just right for you.
It was the right thing for me, absolutely.
So, where did you progress from there once you got into that program?
Well, once I got into the LPN program, I continued in a path of working as a nurse with the thought in mind that I wanted to get everything that I could get partially because from an educational standpoint and getting everything that I could per se was really driven by a second set of parents that had helped to raise me. My dad's oldest brother and his wife, who was Japanese, she always told me, Deborah, education is the most important thing. Continue, get all that you can. And so I knew that I had to pursue doing what I could in the field that I was in to glean the most information, become the wisest person that I could, the most diverse person that I could. And I ended up working in one particular hospital in Cleveland, Tennessee, where I was on a different unit every shift. And I was in a float pool. So
Okay.
one night I might be in ICU, the other night I might be helping deliver babies.
Oh, wow. So you got to experience
So
a little bit of
it
everything.
was amazing.
Yeah.
It was some of the best experience I've ever had, in my life. And I'd made that transition, and I think this is important to kind of note as well. I made this transition into that area and going into Tennessee because in West Virginia, there's not a lot growing up. It's a wonderful place now for people to retire, and I love going back, to visit home. But I had an older sister who'd had a very bad marriage. She'd endured a lot of abuse. She had a son that was about a year older than my daughter, and I was a single mom raising my child, going through nursing school, had graduated, and found out about this extremely abusive situation with my sister. So I said, this is it. I feel the calling to get the U-Haul. We're going to get furniture.
Yeah.
I'm just following God's will. I don't know where I'm going. I don't know where we'll end up, but we are leaving. And it was the most bizarre thing ever.
Yeah.
But I felt compelled to do that. I felt I had to take the leadership role. I had to, number one, protect my sister because I was not about to let this man take her life, possibly, and protect her child and get us to a safer place and get us to a home-based church because I knew we needed that.
Yeah.
So in Cleveland, Tennessee, at a church that I had previously been to with my mom, we established there, found a place to rent, and ended up finding a job at that hospital that I'm telling you about, where I
Okay.
was in the float pool, and my sister found a job at that very same hospital.
wow.
So it worked out, and it was like God was saying, "Yes, you took
Yeah.
the leap of faith, and you listened."
Mm-hmm.
And interestingly enough, I didn't even have the first paycheck. And so, I said, okay, Lord, we have a U-Haul here full of furniture
Yeah.
and two little kids. What's next? And I looked into a local little trader newspaper and saw an advertisement, and I'm always one that thinks big. So, it's 3 bedroom, 2.5 bath brick house. And so I called and I said, this may sound bizarre, but I'm a nurse that's just moved here and I do have a job and I don't have my first paycheck yet, but I've noticed your house and we'd love to look at it and we're here with the U-Haul. And so those kind people actually came over, let us look at the house and let us move in
Wow.
and put in writing with the plan to pay when my first paycheck
No down
arrived.
payment.
No down
Wow.
payment. So,
So when you are walking in God's calling, when He leaves those little breadcrumbs for you along the way, where it's just like, yes, yes, your obedience is being rewarded.
absolutely,
So
absolutely.
in that float pool that you were describing, what was your favorite expertise in being able to experience that?
Probably my favorite arena was in the ICU and CCU
Okay.
area because a lot of the times patients were on life support,
Mm-hmm.
and I felt that that was the most severe case and extent that a person could end up being, on a life support
Yeah.
unit, and gave me tremendous compassion. I'll never forget having one lady in that unit who was probably 400 pounds plus,
Oh, wow.
and we had to get a team of like 6 people just to turn and reposition her in the bed about
Yeah.
every 2 hours. And some of the other people that helped on the team would complain or make ludicrous comments or snide remarks. And I would look at them across, holding onto this bed sheet and say, guys, she may not be able to respond, but she can hear you. Please stop talking like that. But sometimes we lose sight of what's really happening in the human body. We don't understand it on a deep level. And I was in the process of wanting to understand the body absolutely in the best that I could on the deepest level possible.
Yeah.
That lady later came off of life support. She knew everyone by first name in that
Wow.
unit, and she thanked me.
Yeah. That's
And a
awesome.
lot of people lost jobs.
Yeah, I bet they did. Well, and that's very uncommon. I feel like now it's more common to have people that size, but I feel like probably in the time frame that you were going through that, that was a little more odd to see somebody like that.
It
But
was.
I mean, like you said, you never know what someone's going through or been going through unless you get to know them, and I have really learned that a lot lately.
Absolutely. I did learn a lot, and that was one of my most favorite jobs out of everything that I've ever done. There's plenty of others, but one of the things that I've always tried to do in my career is to try to stay on top of not only technology, but stay on top of what people want.
Yeah.
And this is one thing that I saw after being in nursing for very many years was that people wanted one-on-one. They wanted a deeper connect. They wanted a different connection. And so I decided, I've gotten this nursing thing down pat pretty good. Now I want to practice medicine, you know. But I had kids. Daughter number 2 came along,
Yeah.
and what mother wants to wake up at 2 or 3 a.m. on call and leave the house?
Yeah.
Not me.
It's a lot.
So there's too much.
Yeah.
So I began to pray about it, and during that time, I learned that there were nurse practitioners and that you would have the same authority as a physician, but you'd work in collaboration, and you could have your own autonomy, and practice laws varied from one state to another. But that, you didn't have to take on a job that you would be on call.
Yeah.
If you wanted to roll out your own red carpet, you could do that too. So after I got my feet wet and gone through nurse practitioner school, I ended up in Huntsville, Alabama, owning a couple of different clinics, one of which was a wellness clinic that I partnered with a fabulous, beautiful doctor in Huntsville who is now making full circle and kind of coming back and
Yeah.
doing some things with me upcoming in the
Yeah.
retreat.
That's exciting.
And very, very happy that this is the way that I kind of moved forward with just kind of following not only, I don't want to say trends, but following God's guidance and understanding what the people wanted. And I was lucky to hear from a lot of people about, hey, Deborah, why don't you offer this?
Yeah.
You do this. What about that?
So is that really what's shifted your focus to a more holistic focus on things?
Well, I think because my overall training as a nurse practitioner encompassed holistic care, um, some people find it really interesting to learn that there were a lot of things incorporated within our practum aside from just, diagnosing and writing prescriptions, ordering labs, reading them, whatever, that the reality of that became intriguing because you can talk about Eastern medicine principles. You can talk about supplements. You can talk about business law and ethics, which was incorporated in part of our practice. But, we had so much cultural diversity ingrained within us and encouraged by that university to do other treatment and alternative healthcare treatment modalities, which they actually even taught some of those to us. Like you would think, hey, you get that in nurse practitioner school? But we did.
Yeah.
Back in my day, we did. Not sure about the practicum today.
Well, that's what I was going to ask. Do you feel like now, what do you feel like is the biggest focus when people are learning medicine?
Right now, I think the biggest focus in medicine and in Western medicine, which nurse practitioner school is Western, as well, but what they are basically incorporating is fighting disease once it's developed. It's chronic disease management. I'm wearing the white coat. Come in today. Let's
Yeah.
talk about where you're sick.
Yeah.
Let's write a little prescription for that high blood pressure that you now have and that diabetes you've developed.
Mm-hmm.
And there you go. And have a nice day. And I'll see you back for follow up to make sure your blood looks good while you're taking those marvelous pills I've given you.
Yeah.
So that's the way it works. And not knocking it because it is what it is, and we know what we need in this world to help people. But as a nurse practitioner, I knew the benefits of wellness,
Mm-hmm.
of being proactive, preventive health care, and I don't wait
Yeah.
until someone develops full blown
Yeah,
diabetes.
well, I mean, that's
You know,
huge. And I know that's something that we have been talking a lot about for myself lately is just because you go to the doctor and get labs and your labs are A-OK doesn't mean that something's not a little bit high for you, a little bit low for you, but they're not looking at that. They're just like, well, it's within the
it's
range, like
normal.
you should be fine. And
Right.
that's not okay.
It's not
Yeah.
okay, and that's an excellent point. I'm so glad that you bring that up because in Western medicine, the lab range values were created many years ago, and they are pretty much one size fits all. Think about it. Why should it be applicable for you in your decade of life
Mm-hmm.
versus a 7-year-old kid
Yeah.
versus a 92-year-old woman? We all should have specific values that match our age, our genetics, and a host of other
Mm-hmm.
variables. So this is what the functional medicine, aspect is all about. But in Western medicine, that's all that we have.
Yeah.
That ranges 7.35 to 7.45. Do you fit in that? Are you 5 to 10,000 on your white blood cell count? Oh, okay, you're fine.
Yeah.
How's your TSH? Oh, it's in range. But what does that really mean?
Mm-hmm.
It has nothing at all to do with any variables, nothing at all physiologically going on within the body, no known disease, nothing connected to your genetics. It's nothing. It's just a blanket number.
I want to go back to your journey in healthcare. When we talked, you had talked a little bit about a career that you had where God really started speaking to you about people. And I kind of want to dive into that a little bit because I feel like He has given you a gift to recognize things in people. So, talk a little bit about that.
Well, I started noticing that as a combination of things: A, my personality; B, kind of my cultural upbringing, and being in tune with people in general, because that's sort of one of those, I'll say, Japanese principles.
Yeah.
Because with the whole thing that you mentioned about the Shinrin Roku, that's being in tune with nature and
Mm-hmm.
woods and all of that. So I do the same thing with the environment. I do it with people. And when I'm around a person, I have this habit of very quickly, oh, okay, I've got to assess. Got it. All right.
Yeah.
Not so much what's wrong with someone as it is knowing a little bit about what kind of person you're dealing with.
Mm-hmm.
And God gives you a spiritual intuitiveness. But I began to find that as a nurse, that a lot of the interactions that I had with people, family members, specific healthcare issues that they had, that the knowledge base that I was getting just as a nurse in the early years, and then later on as a nurse practitioner, was really helping with their healing trajectories because of that knowledge that God had given me,
Mm-hmm.
that intuitiveness, and most of all, that spiritual sense. Because I believe very strongly that if we do things in His name, we give Him the glory, we give Him the praise, and we tell Him, Heavenly Father, this is not something that I'm doing for my glory because I wear a white coat and I'm
Yeah.
important. This is because someone needs a touch from you today. Someone needs healing, someone needs knowledge, someone needs to get in control of their health care, and they need to be empowered to know what are the things that they can do
Yeah.
to control their own healthcare outcomes.
Mm-hmm.
And sadly, there are just a lot of people, like you said, that never reach to grab that white coat and say, well, hold on just a sec, doc.
Yeah.
What about this?
Yeah.
Because sadly, and I could write a book on this one, we kind of do what I call turnstile cattle medicine, which is herd them in and herd them out. Oh, you're here for a follow up? You've got 15 minutes with me. You
Yeah.
better make it quick.
Well, and 90% of people just accept
You
their
know?
fate after that, you know?
Exactly. And you take it for face value. And you don't address centers of excellence.
You have to pray for God to just align you with the right people as well.
Exactly. And that's why it's so important to have friends that are in medicine in your back pocket and specialists in your back pocket. And this is where I started seeing all along the course of my career where God kept aligning me with people because of my diversity in nursing
Yeah.
and working in different fields and different doctors' offices, different specialty practices, you name it. I just had a real hunger for learning and knowing all that I could and networking with as many people as I could because I found it fantastic.
Yeah.
And I was like a sponge,
Well, yes. And I
you
mean,
know?
that's another thing. You have to be open to different opinions. And like, we can get along and have totally different opinions. And you just take that in and you learn from it and you shift out what you can use and what you can't use. And I think that's so important.
Absolutely. I took total control, and this is a little bit of a funny story that you might appreciate. After having a tubal reanastomosis, having my tubes reconnected so that my husband Dennis and I could have our first child together, went for the surgery, which was a C-section, because I'd had C-sections previously. So, I'd had two already, had another incision in, so that made three. So getting the baby out, that was four. In a vertical that existed, and they went in the old route, because of the fact that that's the way they did it initially with the first, and it was emergent. So with my firstborn, she went into fetal heart distress, and like I told you, very sick, nearly died. But at any rate, I ended up coming home, walking in the door, my oldest daughter carrying in the baby, luckily, and my C-section totally dehisced, just popped wide open.
Oh my gosh.
And that was because the discharge nurse at the hospital had about 7 discharges happening at one time, and she kept complaining, I've got to hurry and get your staples out. Oh, I've got to get these out, and my kids are going, Mom, your stomach's opening up a little. You know, oh, it's fine. We'll get some steri strips. And so they sent me in the wheelchair and on my way. And by the time I stood up and fully walked through the den of the house with the kids, there we were. And so ended up calling my doctor. He had just left for vacation.
Oh, no.
And so Dr. Kakani in Huntsville, a dear friend who I love incredibly, and who actively currently manages all of my bioidentical hormones for me, thank goodness. She said, meet me in the PTA of the emergency room, Deborah. So I met her there, and she said, oh my gosh, we need to get you into surgery. I said, no, we don't. I have a baby that I'm breastfeeding. I cannot have anesthesia again. She goes, what do you want me to do? I said, I want you to get your nurse, get the staple gun, numb me up with some lidocaine, inject me really well, go ahead and get this done and get me stapled up. I said, I'm fine. I've kept the area clean and, all the above. And she goes, are you sure? Yes, ma'am, I'm sure. And then you can give me some prophylactic. Now, here I wasn't even a nurse practitioner yet. You can give me some prophylactic antibiotics when we're done. And I'm giving the doctor the orders now, okay? And so she looks at me, and she does what I ask, and the numbing didn't really work. And so I look at her nurse, and I go get a washcloth. And they both look at me like, a washcloth? She brings back a washcloth. I roll it up, put it between my teeth, tell my husband to get to the head of the bed and hold my hands. And so Dennis holds on to me while I look at her and go, do it. Go. And so she restaples me,
Yeah.
and everything turns out fine. No infection, no problems.
Wow.
So the whole aspect of strength and becoming strong became very apparent in my life in multifaceted ways. And with some of the snippets of stories that I've told you where I learned that I had to be strong, I felt that God ultimately was preparing me for something that would be coming down the road where I would need to have strength.
Yeah.
And little did I know that it would be the most horrific and hardest thing that I would ever face in my life. and would have to rely on the strength, the callings, the knowledge, and the help from God
Yeah.
to make it through because of being a strong warrior woman.
Yeah, we just don't know what he has lined up for us until we get there and get through it and make it through the other side. But we will talk more about that next time. Is there anything you would like to add in wrapping up this one episode? If you had just like one line that maybe you could leave with anybody who's kind of considering maybe being in the healthcare industry, whether it's being a nurse, being a doctor, what would you say to them?
I would say always follow your spiritual instinct, as I call it. And if you feel a calling and you feel led to be in a certain arena and that you have certain abilities or talents or desires to enhance maybe existing talents that you have, listen to that and listen to your inner spirit. Because usually, in my experience, that's God speaking to us, calling us, letting us know that we need to follow His plan in our lives. And don't miss out on that opportunity when it happens.
Till that still small voice.
Listen
Listen
to
to
that
it.
small voice.
Yeah. So that is Deborah. I'm so glad y'all got to hear a little bit about her life today, leading up to these next few episodes. She cares for others, and I think it's possibly a superpower that she has. But even before her own body started sending secret messages, she was helping others and leaning into the calling that God had for her. So, next time we get into the not so fun part when she realized something was off, but no one was quite sure what that was. So, grab your armor or your hoodie because advocacy is about to get real. We'll see you next time. Bye, guys.